The two metatarsophalangeal joints most frequently affected by decreased range of movement are the first MTP joint and the second. The first is normally due to osteoarthritis, and the first thing you'll notice is an enlargement in volume of the joint, some deformity, and maybe some palpable osteophytes over the dorsum of the joint as well. To test for the range of movement, again, put the foot roughly in the neutral position, stabilise the proximal segment, and mobilise the proximal phalanx on the metatarsal, taking it to end range. You need to measure the range of movement, but also feel for the quality of movement during the range, any pain elicited during the range of movement, and finally the end feel, which should feel spongy, like in this case. If it feels like there's bone knocking on bone, an osseous end feel, that's normally indicative of osteoarthritis. In the case of the second MTP joint, this is less frequently affected by osteoarthritis, but sometimes in teen years, girls in particular can complain of having a sudden onset of pain in the joint, which then they forget about. This can be an avascular necrosis taking place, which has come to be known as Freiberg's infraction. What this will do is ultimately flatten off the metatarsal head so that when you undertake a range of movement test, you immediately feel a restriction and a knocking, bone on bone, an osseous end feel with very limited range of movement. Otherwise, this joint has a very good range of movement, as you can see in this foot.